Hi there, everyone. My name's Tyler Roller. I'm 17 and I graduated from Skyview back in May, so a few months ago, so not too long, but kind of long, however you want to look at it. I work as a host at a local restaurant, and I decided to take a couple college classes this summer just to figure out how many courses I think I can handle in the fall and how the courses are set up, just so I wasn't thrown into the college experience all at once. So, obviously, I'm in this class, which means I wrote a research paper. And so, my research paper that I wrote was based on stem cell research in children. So, you're probably thinking, what are stem cells? And I'm sure some of you know, but I'm going to give some background knowledge for those that don't. So, there's two types of stem cells there's pluripotent and totipotent. The pluripotent ones are also referred to as embryonic, the totipotent are referred to as adult. So the embryonic cells come from an embryo, which is the beginning stage of life. The embryo is formed about 2 weeks after the cell has been, or the egg of the female has been fertilized. Some people view life being started at the creation of this embryo, and others view life being started once the essential organs are formed, such as the brain, the heart, the lungs. So there's a little gray area there. So basically, these embryos contain 100 to 200 stem cells, and these cells are able to change into any other type of body cell. So they could change into skin cells, liver cells, brain cells, any type of cell that your body produces. These have the potential to change into. And then you have your adult or totipotent cells, and these are most commonly found in umbilical cord blood from when the child's born. And the most common ones are blood stem cells, and these blood stem cells are able to change into white blood cells, red blood cells, plasma, platelets, any of that. So that's a little background knowledge on stem cells and what they are. So a little background on research with stem cells. So stem cell research was legal from about when stem cells were discovered in the late 80s all the way up until when Bush took presidency. So when Bush took over the presidency, there were about 3 main lines of stem cells out there. And he decided to get a law passed that would essentially block any new lines of stem cell research from being able to be formed. So these 3 lines were the only ones that were going to be allowed to use. Well, unfortunately, 2 of these lines became infected and were unusable. So from the time that Bush was president to the time that Barack Obama became president, we only had 1 line of stem cells that were able to be used for research. So when Obama became president in 2009, one of the first things he did was to repeal this law that blocked new lines of stem cell research. So federal funding was restored to stem cell research, and we have several lines going on right now. And several of these actually deal with the research in children to try to cure childhood diseases. So, a couple of the trials that have gone on. One of the most recent trials and most successful trials to date dealt with a 2.5-year-old who happened to have a heart attack, and I wasn't able to figure out why this 2.5-year-old had a heart attack, if it was another medical condition or the parents were druggies or anything of that sort. I don't know why. But so this child had a heart attack, which caused him to have brain damage and led to cerebral palsy. So this child was pretty much unable to do anything on his own. He was going through constant rehab, and he just wasn't regaining any motor control. So as a last resource, his parents decided to use his cord blood, the stem cells in that they had kept after he was born. So he got daily injections of his stem cells from this cord blood, and lo and behold, within 2 weeks, he had basic motor control back. At the 40-week mark, he was sitting up, trying to walk. He was a normal human being again. Now, he's 5 now, so obviously he's a little behind, and he's always going to have that brain damage, and he's not going to be a normal human being. He will have disabilities, but he will work through those, and he's already regained so much motor control. And the other trial that I found the most interesting has to do with an infant neural disease, which can lead to blindness, seizures, and even premature death. So the original study was conducted in mice, and these mice have a very closely linked disease, and they were given, there was four groups of them. One was injected with no stem cells, the other ones got blood stem cells, some got bone marrow stem cells, and the others got a combo of the two. So the results with this trial were amazing. Most of these mice that were injected with any type of stem cell regained their motor control, and it cured this disease in them. So this led to the beginning stages of a trial in children, and this trial is beginning, I think, within the next few years, and it'll start the study in children to see if the stem cells could possibly cure this disease in children. So basically, the field of stem cell research is constantly gaining ground. And now that Obama has allowed stem cell research to continue, it is gaining a lot of ground in the field of children especially. It's causing so many new trials. If you just watch the news, watch medical information, there's trials being announced daily that deal with stem cells and childhood diseases. Like, we're working on curing cancer, diabetes. There's so many things that could be cured with these stem cells. And you just have to think, like, why not? Why not use stem cells? So I'll leave you on that note. And, like, what's the harm with using these stem cells? So, thank you very much for your time, and feel free to leave any questions in the discussion. Thank you.